Let's now shift focus to the United States and the coronavirus situation there. We spoke to Dr. Anil Kaul, a clinical professor based in the United States, about the nature of coronavirus and its complex diagnosis. United States, of course, happens to be the worst affected region from this disease as of now. Dr. Kaul is also the director of a disease lab that is conducting COVID-19 testings. Let's now listen into what he has to say.
I think in the past many years, we have been getting repeated warnings, sort of, with MERS and SARS and everything else, that this kind of things can happen. But I think we took it, let me put it this way, we took it lightly, and we did not think that this kind of situation will arise. I have been teaching emerging infections for last more than 15 years, and even though I am in the middle of it, at least on the academic side, I have never imagined this kind of situation, how unprepared we were. And I think the virus is virus, and I think it will do anything to survive. So if we give it a room to survive, it will. So I think the best thing what we are learning is that basic, just hand washing, social distancing, those are the things which will help. I think even in U.S. there have been different approaches. I can give you an example of Washington State. They were the first ones to get hit, and what they immediately did is they shut down all the businesses. Every business was shut down, and every big corporation over there, they told employees to stay home, and social distancing basically helped Washington State. Unfortunately, in New York, that did not happen. People ignored it. And look at the situation right now. We have many more cases and many more deaths in New York area compared to Washington State. So these are the basic things. I think India should learn from what Washington State did, basically social distancing. That is the ultimate solution, because I think we have to understand India has a weak public health infrastructure. So the only way, I think if there is a widespread outbreak of COVID-19 in India, our healthcare system cannot handle it. So I think the best approach is what India is doing right now, the social distancing, isolation, and tracking the cases, the contacts. That is the best approach. I think that is what India needs to do. And I think that approach, what in US Washington State did, I think that will work better for India.